In this video, I will be talking about CT scan, basics of CT scan, mainly NCCT brain. This is a very important topic in case of medicine or pediatrics. OSCE, because a CT scan may be given and we can be asked to diagnose. Okay, so starting with the basics, what is CT scan? A CT scan stands for computed tomography. This is an imaging modality which uses X-rays to produce cross-sectional image of different body parts. Okay, it uses X-rays to produce cross-sectional image of different body parts. Okay, and the cross-sectional image are mostly axial. Okay, so in case of NCCT brain, NCCT NC stands for non-contrast. So mostly it is done in the transverse plane, or it is also known as axial plane. So CT scan also uses X-ray. So what is the difference between X-ray and CT? So X-ray, it is clearly a 2D projection, and CT scan, it is a cross-sectional image. So this is a transverse section or axial plane of brain. So what are the structures we can see? Roughly I'm talking about. This white is the hyperdense region. It is a skull. Okay, this hyperdense is the skull. Then this is the brain parenchyma. This is the lateral ventricles. Okay, this blackish area, this is the lateral ventricle. It contains CSF. This is the lateral ventricles. It is pair. Okay, this is 1, this is 2. So it contains CSF, cerebrospinal fluid, and this blackish things, these are the sulcus. These are the sulcus of brain. Okay, so let us see more structures in the brain parenchyma. So around the lateral ventricle, this is the lateral ventricle. Okay, so this is caudate nucleus. This marked in blue is the caudate nucleus. This is lentiform nucleus. Okay, and these are thalamus. These are some structures in the brain parenchyma. And lentiform nucleus is formed actually by 2 more structures. The outer one is called the putamen, and the inner one is called the globus pallidus. Okay, globus pallidus is also divided into globus pallidus externa and globus pallidus interna. Okay, so they constitute one important structure known as basal ganglia. So basal ganglia contains 5 nuclear pair. One is caudate nucleus. This is the caudate nucleus. Then putamen, putamen, which I have mentioned, putamen. Then globus pallidus I have mentioned. This internal part is the globus pallidus. And substantia nigra is another nucleus important, and subthalamic nucleus is also included in basal ganglia. Okay. So another important structure is the internal capsule. Internal capsule, let me show you this area. Okay, this area is the internal capsule. So it has two parts. This is the anterior horn, this is the posterior horn, and this middle part, this bending part, is the genu. Okay, here it is clearly mentioned. This is the anterior limb, this is the posterior limb, this is the genu. Okay, so these are some important part, because there can be CT scan where the bleeding can be, or the hyperdense lesion can be present here. So we can call it as basal ganglia hemorrhage, or the other way, hemorrhage in basal ganglia. Okay, so let us now see the regions of the brain parenchyma. This is the frontal lobe, okay. Then this is temporal lobe, this is parietal lobe, and the posterior part, occipital lobe. This is anterior, this is posterior. So let us solve few important CT scan. Clearly see, there is a, it is called as hyperdense lesion. So it is clearly a hemorrhage. Okay, this region is hyperdense. It became hyperdense due to blood, and clots, due to blood. Okay, and another important thing which I forgot to mention is the site determination. In case of CT scan, see, our left is the CT scans or the patient right, and our right is the patient's left side. Okay, this is very important. Okay, so where we were, so there is a hyperdense lesion which is due to hemorrhage. Okay, this is our right side. Okay, so it is patient's left side. In the left side, patient left side, our right is patient's left side. So how do we diagnose this? This area is near the ventricle, right? Near the lateral ventricles. So we will call this as basal ganglia hemorrhage. Okay. So there is a hyperdense lesion or the hyperdense area located in the left basal ganglia. So diagnosis is left-sided basal ganglia hemorrhage. This is for undergraduate level, this is not for postgraduate level. I am only saying the basics, means whatever is required for undergraduate MBBS level. Okay, so there is hyperdense lesion and it is due to hemorrhage. In the second example of CT scan, there is a hypodense area or lesion. Now, in which region of the brain parenchyma this hypodense lesion is present? So it is present in the frontal lobe. It is also present in the temporal lobe, right? These are the lobes which we have studied earlier. This is the temporal lobe, this is the parietal lobe. So does this CT shows any parietal involvement? Yes. See, the parietal lobe is present here, so there is also infarct in this region also. So frontal lobe present, infarct in temporal lobe is also present, and infarct in parietal lobe is present. The hypodense area is present in the parietal lobe also. So we say it like this. And which side? It is in the left side of the patient. Our right is patient's left side. Okay, so left-sided hypodense area in frontal, parietal and temporal lobe. So diagnosis is left fronto parieto temporal infarct. Okay, this is very important. If the lesion is hyperdense, then it is due to hemorrhage. But if the lesion is hypodense, it is due to infarct. This is very important. So another important examples are the intraparenchymal hemorrhage and subdural hemorrhage, as well as extradural hemorrhage. So let us now see the skull. This is the skull. Beneath the skull lie the meninges. Meninges has three layers. One is dura mater, one is arachnoid, the last layer is the pia mater. The brain lies just beneath the pia mater. Okay, just beneath the pia mater, it is the brain parenchyma. Okay, so intraparenchymal hemorrhage, so it's clear, it lies in the brain parenchyma. But subdural hemorrhage, subdural means it lies between the dura mater and arachnoid mater. The hemorrhage lies here between the dura and arachnoid. Okay, and extradural means it lies between the skull and the dura mater. Skull, dura. This is the extradural hemorrhage, EDH. See the difference in the CT scan shape. The shape in case of extradural hemorrhage or EDH, it is biconvex. Biconvex or lens shaped. Another important characteristic, it does not, let me write here, does not cross suture line. Our brain has multiple suture, right? It does not cross the suture line. But in case of subdural hemorrhage, it crosses the suture line and the shape is, see, here it is concave and here it is convex. So the shape is clearly concave or convex, right? Concavo, convex, or crescenteric. Concave, convex, or crescenteric shape in case of subdural hemorrhage, and extradural hemorrhage EDH, it is biconvex. Biconvex. Okay, and intraparenchymal too, it is intraparenchymal, it's clearly seen. And in case of subdural hemorrhage, there is a midline shift, is also important. Subdural hemorrhage, it occurs mainly in elderly patient post trivial injury, right? In case of extradural hemorrhage, it occurs in case of head injury or high velocity impact. Subdural hemorrhage mainly occurs in elderly due to trivial injury. Okay, now coming to hydrocephalus or hydrocephalus, however you can say. Hydrocephalus is actually dilatation of the ventricles. It mainly occurs due to obstruction to the flow of cerebrospinal fluid, CSF, right? So the ventricles become dilated. There are so many ways, there are so many causes which can be grouped into obstructive causes as well as congenital causes. It requires a separate video to explain all those causes, but this is clearly dilated lateral ventricles, so it is in CT scan of hydrocephalus.